Okay, so hi everyone. This is Dr. Tomoko Ito. Thank you for your time. I'm going to talk about mental health issue among Japanese athletes, and later I want to discuss barrier or challenge to introduce sport medicine, sport physician in Japan. Probably you have the similar experience in Taiwan as well. Okay, let's go to the next. So this is my introduction. Education, I got MD in 2008 from Hokkaido University, which is quite popular place in Japan, right? And master sport medicine at UCL, like Martin or Steve last year. Certification is here. And activity, I'm a family physician in Japan, so most of my job is outpatient clinic and teaching residents. So like weekends, I go to recreational races or competition as first aid doctor. And once I was working as team doctor of Toyota women's basketball team. During my residency, I went to Michigan University to shadow fellow of sport medicine. And I realized that sport doctors are not only orthopedic surgeons, but we still have opportunity to be a sport physician as family physician. Okay, that's all my introduction. Okay, I'm going to go to poster presentation, but it's supposed to be present at the official conference. So I really want to finish within 3 minutes. It will be quite fast, but after that, I will receive your questions, okay? Okay, let's start. Hello, everyone. This is Dr. Ito from Japan. I will present my project, Alcohol Use Disorder among professional soccer players in Japan. Excessive alcohol consumption is known to have negative impact on the sport performance and recovery. However, previous is more prevalent among athlete than non-athlete. Preseason and male gender is well-known risk factor. The level of association with other risk factors varies between studies. Drinking behavior is influenced by surrounding drinking culture. However, previous research is mostly from Western countries. Little is known about athletes in Japan. So the aim of this study is to estimate the prevalence of AUD and explore the association with risk factors in players in Japan. Let's go to the method. We conducted anonymous online survey in 2020 preseason. We recruited the participants voluntarily. 112 players were invited and 59 were analyzed. Okay, so demographic data is here. Age, educational level, history of injuries, illness, and mental illness. Okay, we defined AUD as 4 or more on audit C score because the cutoff is widely used in practical setting in Japan. The prevalence is 38.9, this orange and yellow part, with the other cutoff of 5 or more, here orange, the prevalence was 16.9. Binge drinking was defined as 6 or more units per occasion. 47%, yellow, orange, red part, had binge drinking at least once in the previous year. Significant association work here. Okay, so go to discussion. In this group, the prevalence of AUD or binge drinking is not low, at least. A systematic review reported the prevalence of AUD was 18, with the most study used a cutoff of 5 or more. The comparison with the previous study or general Japanese population was difficult because there is no standard assessment tool nor cutoff. The limitation of our study are risk of selection bias. single time point assessment, and small sample. So the next step is here, future plan. We need to have longitudinal and larger sampling from various sport or play levels. And we also will investigate why or when they drink heavily or how they feel about AUD with qualitative study here. So conclusions, better understanding is necessary to develop the effective prevention strategy. Thank you. Okay. Do you have any question? Like, do you have a similar problem in Taiwan? Or if you have this kind of problem, do you have anyone to deal with it or you can talk to or a system?
大家有没有什么问题想要问 Tomoko 的 ？Any question?
Yeah.
I can. Sorry.
No, you first.
Okay. Hi, Dr. Ito. Right. Ito?
Tomoko.
Yeah, Tomoko. Yeah, whatever.
Okay. So my question is, you mentioned one of the risk factors is sex, right? Or gender. You can say that men actually have higher risk of having this issue, AUD. So have you actually compared? I saw like in the table you separate like the let me see. Do you have the sex not
Oh, actually, this research is all done for male players.
Male only?
Yeah. So that's why I couldn't compare with male and female.
Female.
Yeah.
Okay. Yeah. Interesting. Thank you.
Yeah, because as you know, we don't have female professional league for soccer yet.
Okay.
Yeah.
Thank you.
Thank you.
Anyone else?
Me.
Okay, hi, Steve.
So Tomoko, I've just been curious. So you said you're going to have a qualitative study. So what kind of policy you would suggest or you might think would be like to prevent your soccer players from drinking alcohol too much?
So policy, what do you mean in policy?
Like, I mean like suggestions?
Okay,
like
so,
your plan.
Okay. With this quantitative study, we can see only association, but cannot tell causal relationship, why they drink. They drink and they have bad outcome or they have some adverse event or something and then drink. So by knowing these facts, we can provide effective intervention. You know what I mean?
Yes, I do.
Yeah, so for example, I listed 2 examples, why and when drunk heavily, and after drinking heavily, how they feel. Or I'm not sure, but some athletes feel like heavy drinking is a reward of their winning. But at the same time, they have kind of damage physically and mentally. So I'm so curious how they feel about AUD, drinking heavily.
Okay, thank you.
Thank you.
Okay, and we got the audience, and she, I don't know if he or she, but she said like we have the same issue in Taiwan as well, both among student athletes and professional athletes, and there is actually many studies about these topics. So maybe you can search, but I don't know whether it is in English version or in Mandarin version. I'm not sure. Yeah. Anyone else have question?
Can I add?
Yeah.
So in the previous study, the target is mostly student athletes, not professional.
Okay.
Yeah, but if you have good research, let me know. Thank you.
And question from myself. So do you see any association in the AUD population and with the association between AUD and psychological disease or like psychological impairment? For example, like you do have higher depression or higher like anxiety among these population. because your time of the sampling is pre-season. So I'm wondering, the questionnaire you're using is asking them the average of alcohol they're using, or like some specific time period, for example, pre-season or in-season. Is there a difference between pre-season time and in-season time, and which one might have a higher like percentage of AUD?
Yeah, that's a good question. And then thank you, Martin. So in the previous study, it's quite clear that athletes drink alcohol heavily during preseason. So for example, one study showed the prevalence of AUD during the season, only 2%, quite much lower than general population. But on the other hand, before the season or after, the season, they drink quite a lot. And so as I said, this research has limitation of small sample, so I cannot conclude anything. But I think some studies said like there is a association between mental health, a history of mental health illness, and this kind of thing. And then, as you may know, this project is also included depression and anxiety. In this poster, I just present about alcohol, but in my whole study, there is no relationship between depression or anxiety and alcohol misuse.
Okay,
but yeah,
that's quite interesting.
Yeah.
And you asked a question about whether Taiwanese athletes do have some professional teams to deal with their mental health problem. As far as I know, the professional team nearest to the athlete will be athletic trainers normally, and recently more and more physiotherapists start to kick in, but we don't have much resources like the money. We don't have much money to give this professionalist. So normally maybe only AT or PT needs to take care of these patients. Yeah, but
same here.
Is it the same in the elite setting or just like student athlete? Even in like J League, is it the same?
Yes. So my participants are professional players, but they cannot afford to hire official psychologist or psychiatrist. And then team doctors are mainly orthopedic surgeon. They are not really good at dealing with mental health problem.
Is it they're not good at dealing mental health problem, or they didn't even care about
they
mental
don't know
health?
they don't know how to do it? So yeah, there is some confidentiality, so I cannot tell everything. But yeah, they have problem anyways.
Okay, so any question from the audience? Yeah, please.
Hello, Dr. Tomoko. I'm Danny. I would like to ask a question that may not strictly related to the poster, but according to your presentation and your experience in working with the player within the J League, or let's say the team, what's your experience or opinions regarding the let's say the style of coaching? Because we all know how the coach approached the team has a very significant influence on the soccer player and their psychological issues.
Okay, thank you for the question. So the reason why I chose this topic is that players are struggling from mental health problem, but nobody can take care of it. I had a personal story from trainer friend, and in the reality in Japan, many staff, like including doctors, they're not really confident in taking care of mental health problems. So they didn't check if somebody has this kind of problem. But by doing this survey, some player had a depression or mental health problem. And escalate aspect, I told the doctors, but yeah, they say like they don't have, you know, good system to support them. So this is the first step to improve the field, you know.
Yeah.
So we are still developing, like Taiwan. I don't know.
Yeah,
So-
because yeah, please.
Yeah, go ahead.
Yeah, because what you said is like a few years ago, I was with a soccer coach when I visited Japan, and I saw the way they coach the player. It's I think I was a football player before, so in my experience, it's like their coach told what they should do, and they just do it over again to their athletes. And in my experience, like they are not really, how to say that, they're not really asking them to think or to express their opinions or emotions and so on. Maybe it's about culture, maybe it's about efficiency, I don't know. But in this way, I discovered that for myself, you become more reserved and just suck it on and drive on, something like that. Yeah. So and from what I heard is like you are trying to bring up the awareness toward those the medical society and also, as well as the coach and the supporting system to provide a more balanced and more holistic way to take care of the athletes.
Yeah, exactly. So do you know the word stigma? Yeah, so in the previous study, even from Western countries, the stigma is quite, you know, huge barrier for athletes and staff involving with the sport teams, right? So the real purpose of my study is to share the fact. Actually, the athletes are struggling from mental health issue. And by doing so, I think, you know, general population or society can understand the real situation among athletes. And only, you know, even though we don't have, we cannot provide specific like support, if the society is open to their problem, they can feel free to talk about their problem, which can help their problem as well. Right. So I think this project is to have people or general population awareness of mental health problem in sport world.
Okay, so
did I answer to your question?
Yeah, thank you.
Okay, so we have 3 other questions. So first one comes from Steve again.
Yeah, so Tomoko, come back to your conclusion.
Okay.
So I saw into the demographic data. I saw that you talk about the educational level and the current injury or the past mental illness, because like what we talked about before. So you said that the players are really hard to face their mental illness. But while in your demographic data, I only saw 3, I mean like very small population of they had past mental illness. So I think the study you did should mention about like to point out like what you just concluded, that I believe there's still a very big population of players now having mental illness while they performing the appearance like AUD. They should really go to see like psychologists or something like that.
Yeah, so this is another limitation of, you know, this kind of study. Even though this survey is anonymous, they don't trust. And this link was provided via, you know, through the team doctors or trainers. So to be honest, I really don't think they're really honest in answering these questions. Plus, as I said, mental health problem is not accepted widely in Japanese society. So I think, you know, they hesitate to express they have problem, or even though they have kind of symptoms, they didn't see doctors and didn't get diagnosis from medical professionals. So probably, as you said, Steve, more athletes had mental health problem in the past, but this is the data. Okay.
Yeah, I mean, like that's the part I think you can work on it.
Yeah, so with better literacy, I think we can get much better data in the future.
Okay, then the next question is from Anita.
So because you Tomoko, right?
Yep.
Tomoko mentioned stigma of the mental health issue also is a problem in the Western culture. And I got my master and doctorate degree in the United States, so I can probably share some of my experience. Yeah, and my program, my background is athletic trainers. So from my experience, you're right. I think even in the United States, in general population, like we already know athlete, not only athlete, just like young students, they struggle with mental health issue. And more, especially in athletic training field, they started putting some survey or questionnaire pre-injury or post-injury or during their pre-participation examinations to start to monitor athletes' mental health. And a lot of time, because I've never really worked in professional sports, so I cannot like really say anything about their protocol, but at least in Division 1, 2, 3 school I have been at, they basically collaborate with consulting center at that university to work with their athletes. So for example, like if athlete starting have some signs and symptoms, of course, whether athletic trainers or coaches, they aware with those signs and symptoms is really important. So if somebody notice something, athlete perform or behave a little bit different from what they were, they, depending on how comfortable they are, but our training as an athletic trainer, basically, if we notice anything, we should already have referral systems to refer athletes to somebody else can help them. So that was my experience. Like this has been developed, and stigma definitely is there, and this also depending on what type of sports. If the sport is like really men dominated, and that mentality is like you have to be really tough, really resilient. The story might be a little bit different, but I would say in men's sports, they probably have more issue expressing their weakness, because sometimes they see mental health issue as a kind of a weakness. But female sports, typically their report rate will be higher. It's not
exactly.
It's not because female have higher issue or higher risk of having mental health issue, just they feel a little bit better to express their concern. Yeah, that is my experience.
Yeah, thank you. Yeah, that's true. And actually, so when we compare with athlete and non-athletes, there's a different stigma and then pressures. And then at the same time, when we compare between countries, like Western countries and Asian countries, generally their, how can I say, their way to receive or mental health is different. For example, among general population, in Western countries, the prevalence is much higher than Asian countries. Even, between Asian countries, East Asia, like us, and Southeast Asia have different tendencies. So I think that's why we cannot simply compare with Western countries' results. That's why we need to have our own data, and based on the data, we need to think about the effective, strategy, because mental health issue is really based on cultural background. We're not like Western culture, right? So of course we have something in common, but we have something different as well. That's why we need to have mental health survey on each culture or country. Make sense?
Yeah. Okay. Tomoko, the last question, and we will move on the next section.
Okay.
This last question was from 乃元。
我是 Gary， 那我可以请 Martin 帮我翻译一下吗？
可以。
好，我要请问那个 Dr. Tomoko， 就是说在日本的，相比于这个日本专业足球员、男性足球员来说，那日本的社会人士 AUD 的发生率是多少呢？这样。
Okay, so his question is about the prevalence of the AUD in general population compared to the population you are now studying in the elite athlete in Japanese soccer. Do you have any data about the general population?
So of course, I try to compare it with the general population, but the definition of AUD is totally different. In the national survey for general population, the AUD definition was based on the total amount of alcohol consumption in the volume, how many milligram or gram per year, things like that. So it was almost impossible to compare with it. So just simply comparing the number, athletes has higher, but it doesn't mean anything.
Okay.
Yeah.
Okay. So let's move on to the next part you want to share with us.
Yeah.
Okay.
Okay. So next part is discussion. Just feel free to talk about it. Okay. So this is what I felt like Japan needs to do when I returned from the UK. I learned multidisciplinary team is really important, and before studying at UCL, to be honest, I really didn't know what physical therapists can do, and then how they're how knowledgeable or how skillful they are. But after the study there and then working together with other professionals, I realized that it's really powerful to work together with other medical professionals. So to achieve a good team, I think it's a key to have good and open communication with other professionals. And so I'm not sure if it's true in Taiwan, but in Japan, medical society is kind of hierarchy. The doctors is located on the top, but actually we have various, competence. So I think we should appreciate and respect each other. The next one, education is really important. And in addition to having only educational program, it should be multidisciplinary study, like we had at UCL. Our classmates are mixed with doctors, GPs, and physios, and other sport analysts and SNC trainers. And it's really good opportunity to know what they can do, and then what we can rely on them, and then what we can do, and then what we can do for them, like that. And as I said before, in Japan, most of the sport doctors are orthopedic surgeons, but they're really good at fixing or fixing traumas, injuries. But actually, athletes they have problem like internal medicine stuff, mental health problem, women's health problem, and not only disease or illness, they need to maintain their health to perform in their best, right? So educational program is really necessary. And the last one, so in 2020, now, like a 2021, 2022, we have a lot of information about medicine and sport medicine. So we cannot complete everything by ourselves. We need to share individuals' knowledge or experiences. Someone is really good at, working at venue, but unfortunately, they are not really good to have knowledge. But on the other hand, some person B can have good knowledge, but they are not really good at communication with the staff or something like that. So if we combine our capability, the team can produce really good service to the team or society. That's my opinion. This is a summary, features SEM in Japan. No borders between professionals, career, nationalities. So we can work together, Japan and Taiwanese and in Asia. And next one, respect each other, skills, knowledges, and opinions as well. There's no hierarchy. Challenging a new thing, learn from the past and other professionals. And no hesitation to try something new. Okay, go to the barrier to introduce sport physics in Japan. As I think you may know, Japan is not really good at accepting new things, right? It's quite commonly known. So new concept, and I had conflict with existing system or groups, and especially sport medicine is competitive field, and existing system or group had already controlled the world society. So it was really difficult to get into the field. Yeah, and then I'm rather young and female in this field, so they're not really happy to have me, to be honest. Okay, and next one, unclear career path. So before going to London, I noticed that there's no role model. That's the reason why I decided to study abroad. But still, we don't have good role models. Hopefully I will be the one, but not right now. So I would recommend young doctors or students to study abroad and then see how the sport medicine works in the real world, in the States or in the UK or Australia. And in Japan, there's no official certification to guarantee the competency. I have one kind of certification as sport medicine doctor, but if I attend some lectures and then I have some experiences out field or races, I can get the certification. So which doesn't mean the certification can guarantee the quality of the holders. And there's no educational program. So to have certification holder with a certain level of competence, we need to have official certification and educational system, like United States or UK or Australia. Okay, to come over these barriers, I have two challenges. One is promotion activity, and then second one is education again. I have done some of them, promotion activity. So at first I tried to talk to doctors, but actually our target is athletes or patients. So, and we need to work together with sport medicine professionals, not only doctors, like, physio, trainers, and then dietitian, many, professionals. And then also we need to promote to general population, like athletes. We can help them. And then if they realize that we are really helpful and useful to them, they will tell somebody, and then eventually this society will accept us. That's my plan. And the method is lectures, SNN publication. These are kind of media. But at the same time, we need to show what we can do in person at venue, and then we can gain the trust. Okay, let's go to the education. So as I said, we don't have enough role models in Japan. So I recommend if somebody want to be a sport physician or professionals in sport medicine field, I really strongly recommend them to go to overseas, not official study, but at least observe what they're working with team, how they collaborate in a team. And again, official reliable certification. And then to get the certification, we need to have a training program everyone agreed with. Okay, the summary. Sport physician in Japan, promotion, media, and performance at venues, and competence granted by certification and a program, and collaboration with existing system. Yeah, that's it. Okay, that's all my presentation. Do you have any questions? These are from me. What do you think about Japan's situation? I'm not sure if you guys know the reality here, but I would like to know how you're doing in Taiwan as well, and how do you communicate with other staff in a team or daily practice, and what do you think about having international collaboration as Asia? That's all. Thank you for listening.
Okay, thank you, Tomoko, for your wonderful presentation. So can you go back to the previous slides on your question? So anyone have like a comment about these questions? Do anyone want to make some comment? Okay, maybe I'll go first. So like 6 years ago or 5 years ago, I went to Tsukuba University to visit their team. So originally I went there 8 years ago, maybe, as a badminton player in our varsity. And we go there for like an exchange training program. So we train with their athlete for 3 days and do like a tourist 4 days in Tokyo, playing around, hanging around. Yeah, and then I asked the coach then whether they do have a sport medicine team to deal with all of the MSK problem or other kind of problem in their team. And he responded to me like, yes, they do have one. And after 2 or 3 years after, I wrote an email to him and he arranged like a short trip for me to go there, like doing a shadowing. And at that moment, I found like, just similar to what you have said, most of the sport physicians are orthopedic, but in Taiwan, it's a little bit different. Many physical medicine and rehabilitation doctors are doing sport medicine in Taiwan. Compared to Japan, I think it's a little bit different, because I asked them about what is the job of a PMR doctors in Japan, and they doing normally in neurological deficit patient, for example, like stroke, spinal cord injury, these traditional neurological disease. And you do have the same system as Taiwan. You do have athletic trainers, but I think both athletic trainers in Taiwan and Japan are facing the same problem. They are not like a very official job. You don't have to pass the test from the government to get it like a formal license. So I don't know, like 5 years later, is there any different in Japan? But I think we might be in quite similar situation. Yeah.
Okay, thank you. So in Japan, we also have a department of rehabilitation, but they're really focused on, recovery from stroke or regenerate the neuron cells, things like that. I've never heard of anyone who is interested in maintaining the health or recovery from injuries. Yeah. So I think we don't have that kind of professionals in rehabilitation.
Okay, and I think we do have a lot of coaches, no matter you are the sport specific coach or you are a strength and conditioning coach, and we do have many physiotherapists no matter you are in a hospital setting or you are in a team setting. And also we do have many athletic trainers in the meeting now. So do anyone want to share your experience to how to communicate with the doctors or like to the health providers? Anyone?
Hi, Tomoko.
Yep. Hi.
Hi, Martin. I also graduate from UCL. I'm so excited the view that you just showed the last slides. And I'm one of the dietitians in Taiwan, and I'm so curious about. I'm
sorry,
not so
your
familiar
voice
with
is
the
breaking.
Japanese system, hospital system.
Sorry,
Is it better
Ariel,
now?
your signal is not consistent.
And should I speak again?
Yeah.
Is
Yeah.
it okay now?
Yeah, it's good.
Okay. As one of the as one of the medical professional team, probably related to sport nutrition, I am quite interested and curious about it. Do you have any experience like just you mentioned earlier, like you have multidisciplinary team to discuss one case, and any cases that dietitian involved? Any experience
not
like
yet.
that? Not really, right?
Yeah, because
Same here.
Yeah, not yet. And then I have some trainer friend who got licensed in the States, but as Martin said, athletic trainers or other professional doesn't have I don't know how to say, permission to provide some medical procedures or like a right to express their opinions culturally. So we cannot, unfortunately, we cannot have enough opportunity to discuss in a certain case. Yeah.
Is it possible even in gym?
In gym?
Like any, gym.
Gym. Oh, sorry, I'm not working for a gym.
I know. I mean, do you know that? I know it probably not happened in hospital because you're a doctor, right? But it happens in Japan in gym, like given taught any diet related to tailored plan for the patients, it's also clients.
You're right.
About sport nutrition.
I've heard some program provide instruction or information in terms of nutrition or good exercises, but I haven't joined them. And then I'm not sure if their information is really trustworthy or not, because I don't know. Next step and future plan. That's a problem actually. We have a lot of like an exercise program or gym program, but there's no standard like guarantee of the competence again. So like infodemic, people don't know which information is reliable or not. So I like to provide appropriate and then reliable information to the society. But the next problem is that how I can have people trust me. Like, if I, just spread my information to the society, they cannot tell my information is not like some like a trash information. You know what I mean?
Is it because also the like cultural problem that you mentioned earlier, the female and young?
And then people, I don't know how they decide to take the advice from somebody. Maybe friends, or trust resources. That sometimes for someone it's doctors or physician, medical professionals, but for somebody like a friend, and then somebody, celebrities, comments, or yeah. So I think it's a quite common problem everybody is facing in the world, right? Yeah. Sorry, I didn't answer to your question. So is it okay?
Okay, so anyone have a question or like a comment to Tomoko?
I can probably, I think my experience is quite mixed. So I have experience working in Taiwan before with medical medicine team, and also I've experienced like I didn't really work in United States, but I had experience like learning their system. So I was start with United States. I think they just like went a little bit far away from us a bit, right? Like in Asian country right now, sport medicine systems or those type of collaborations, we just begin, but they have been working on this probably 50 years. So they seems a bit better, but doesn't mean that we not good. We just beginning. So
yeah, exactly.
Yeah, definitely. And culturally, I would say what I see in United States, because in their systems, they don't really have that much hierarchy issue. So like more respect to different professionals. So it's easier to like athletic trainers can talk to physicians parallelly. But it seems like in Japan, like if you are in different professional, it's harder to really collaborate with each other, because culturally it seems there is some hierarchy, and this is true in Taiwan as well. So I understand what you're saying, and this is what Martin actually is trying really hard right now to start with new associations to break this bad hierarchy issue, to prevent potential concern when we collaborate with different professionals. Yeah, and talking about communicate with different professional, I think policy is really important. So in United States, why people listen to physician? It's because physicians have the responsibility to follow rules, which is state law. And state law say, okay, after concussion, athlete before return to play, physician need to evaluate and sign and release their athlete. So everybody listen. So you cannot really say we communicate, because we have to listen. Coach have to listen. Athlete and their parents need to listen. And because that physician take that responsibility, so they will go through proper training to ensure there is no like other negligent, that type of issue in the future, like athlete come back and then sue them. So they have been through this process and develop policy laws. So they run in that way. And but we just in the beginning. So I would say probably in the future, if we can, I don't know, Taiwan as well can start to from the policy level, starting having some rules in place, who responsible for what, because they have that background to make that clinical decision. And so people will listen to that professional, or can refer the athlete to that professional to make a clinical decision for athletes, like better well. I would say that this is the whole like system issue. It's hard.
Yeah, right. Yeah, I totally agree with you. And fortunately, me and then Martin is doctors. So if we change our like attitude, we can change the hierarchy, maybe no hierarchy system in the future. So I think it's possible to have this kind of society, but the problem is that how we can recruit the other professionals with the proper competence. But with this kind of activity or forming groups, we can make something what we want to have. Yeah, gradually, not like suddenly, but I think we're on the track now.
Yeah, I think the only thing you need to do is try to do the first step, and everything will follow it. So we cannot like do it like instantly, but certainly like maybe years after, if we still hold on to our concept, and something might change. And I just want to add on another like quite interesting and inspiring concept from the BASM, so British Association of Sport Exercise Medicine, their spring conference. So they talk about the difference between multidisciplinary team and interdisciplinary team. So multidisciplinary team is like we do have many different specialties, but within this team, we don't really collaborate and we don't really emphasize the integrate practice about it. But an interdisciplinary team is combined with many different expertise, and we work on together and we integrate all of our knowledge and to provide the athlete or our client or our patient the best practice for them to achieve their goal or their obstacle or their objective. Yeah, so this is quite an interesting concept. So maybe first we have to try to achieve the multidisciplinary team, and then we have to go into an interdisciplinary team.
Exactly. We need to change the culture.
Yeah, okay. So the next, Jack has a question.
Okay, hi, Tomoko, right?
Yeah, hi.
I'm Jack, I'm a physio. I'm just going to share with you some of my personal experience because I used to work with the national track and field team in Taiwan. We also go abroad to the US for training. And actually, I think we have the same situation and concern regarding different countries. So as you said, like you want to work with others, you want to have good communication, but I think maybe in the worldwide, we have the same concern. So it's fine. It's just like, yeah, again, like Martin said, you have to take the first step. And the second thing is sometimes I think it's more about the resources. It's not depending on, are we knowledgeable, or it's about like if the athlete has resources. What I mean by that is like, so I play tennis. I know like maybe the top 50 tennis player in the world, they do have they have physician, nutritionist, psychologist, physiotherapist, but because they have money. Otherwise, I mean, maybe one of our best tennis player in Taiwan, Liu, like when he travels, maybe just one physio or like his manager. So it's really depending on the resources. And honestly, while I was working in the National Sports Training Center in Taiwan, I think it's not bad right now. I mean, it's getting better. So what I mean by that is at least every team or even some of the athletes, they have their personal physio or athletic trainer. And how we work with the doctor is more like, they have like a weekly visit doctor. They are profession in orthopedic or family doctor, or even like Gina, oh my God, the one with order. Yes. So they have different professions. So if my athlete have a problem, I just said, oh, you have to go to a clinic, and maybe I will go with him and just ask, oh, how can I help you with, is there anything I can do as a physio, or what do you want me to do? Do you have to take care of something else like that? So we do have access to different professionals, but it's more about, like you guys just said, do we have a good communication? Because sometimes we just use our own opinions to judge. So for example, okay, this guy have a Achilles tendinopathy. The doctor may say, oh, I need injection, medicine, I need shockwave. But in physio, his view will think of maybe exercise training, stretching, something like that. So as long as every profession will respect other, or they know you're good at something, then everything will be fine. Yeah. I mean, to be honest, in the training center, we have a really good access of medical doctor, physio, athletic trainer. But the only thing I think we're lacking of is nutritionists and psychologists, because most of the athletes don't know what they can do. For example, most of our athletes know, oh, the nutritionist can make protein shake for them, can make just put some fruits, protein into like bottle and shake. That's what they think about a nutritionist. Or if they have a mental problem, they won't think about psychologists, maybe just find a coach to discuss with them. So I think it's more about, I think they do have the assets in a national level player, but it's about, do they know what they can do, or do I have some benefits? I think last time we discussed a case about, like, she's a professional tennis player and she had osteoporosis, stress fracture, and she has maybe some mental problem, and she doesn't want to eat right now. And if she go to doctor, the doctor will say, oh, you're fine, your menstrual cycle is okay, it's normal. But later we might find out it's like a female triad. So the most beneficial guy she can find maybe probably is nutritionist or psychologist. So I think we do share the same concerns, but I think it's getting better right now, so it's fine. And also in Taiwan, we do have less female doctors, but I'm not sure why. Maybe because most of the athletes are male, so they want to travel with them. Maybe they share the same room. Maybe a male doctor will be better. But I think it's not like a sexual discrimination thing. So I think in Taiwan, I'm not sure about in Japan. So that's my opinion, just so you know.
Yeah, very interesting. Thank you very much. So we can learn from you guys. Yeah.
We can learn from each other. So, Anita, do you have another question?
I can share what I saw in Taiwan as well. So in the past, probably 10 years ago, only national level athletes have access to those resources. But what I see right now, our government actually put a lot of money and resources, try to push this like a sport medicine or whole person care, these concept in like push this in lower level. So not lower level, like younger athlete.
Yeah, or general or recreational level.
Yeah. So in Taiwan, in high school, a lot of high school, they have what we call sport program, or we will say in high school, there's like one class of students, they all athlete. So they are in the same class basically. And so they play sports basically all year long, play one sport. This is another issue, right? Like early sports specialization, but not a problem. This is not a topic for today, but because Taiwan, our high school system have sport program, so the government hire sport coach. Sport coach is one of the official personnel in this system, and since I would say probably since 5-6 years ago, they started to hire athletic trainers and physical therapists. So they work in high school, and so each high school have probably 1 or 2 AT or PT. And even though we know only one athletic trainer or PT is not enough, but at least have someone else practice locally at one school, and these AT or PT can help to develop what's like a network. So develop a networking locally. So for example, first of all, of course, these AT or PT have to go and find someone else, physician or nutritionist, or for psychological issue locally, and develop those relationships. At least have the phone in your phone, right? So like anytime if something happen, can refer this athlete to certain professional can help these athlete. And one thing is because, and this, I believe this is the same in Japan as well, because in Taiwan, we have universal health insurance. So it's actually easier to refer athlete because medical expense is not that expensive.
Exactly.
So what typically athletic trainers do is to help athlete identify which doctor or which clinic you should go to, and then we
triage, right?
Yes, and we recommend, and sometimes we even help our athlete to just like, okay, to communicate, and then we bring them to that profession. And normally athletic trainers is gonna be in the room, so can help with the communication, because a lot of time physicians, what physicians say, probably athlete doesn't really understand, or their parent doesn't really understand. So we try to translate those jargons. So these systems is running pretty well in Taiwan. I would say that.
Yeah, I think that can be a really good model. Even the number is not enough right now. Yeah.
Okay,
thank you.
So because we're a little bit delayed, so we will stop it here. And if you do have any question, you can type in the chat bar, and Tomoko, you can look at the chat bar, because there's another question asking you about your poster, what is the definition of mental health illness in your study? So maybe you can reply it in the chat box.
Okay.
Okay.
All right. I will.
Thank you very much.
Thank you for listening.